sharing you guys everything that I know about pulmonary hypertension. So I hope you guys could stay with me all throughout this video, and I will try to do my best to make things easier for you guys to understand everything. So let's start with what is pulmonary hypertension. Pulmonary hypertension refers to high blood pressure in the blood vessels of the lungs. The lungs receive oxygen poor blood from the right side of the heart. After being reoxygenated, oxygen-rich blood returns to the left side of the heart to be pumped out to the body. Normally, the right ventricle pumps against a low-resistance pulmonary circuit. Increased blood pressure in the lungs results in a greater resistance. The right heart must work harder to push blood through pulmonary arteries. This causes the right ventricle to thicken, enlarge, and eventually fail, a condition known as right-sided heart failure. Symptoms of pulmonary hypertension may include shortness of breath, tiredness, and swelling in the legs, ankles, feet, or tummy. As you all know, pulmonary hypertension is classified into 5 groups based on the cause and mechanism of the disease. So, in the first group, we have pulmonary arterial hypertension, or PAH. PAH affects mostly the arterioles, the smaller arteries of the lungs. PAH can be caused by a number of factors, including genetics and other health conditions. For many cases, the cause is unknown, regardless of the underlying cause. However, the group shares similar pathological changes. These include increased activities of vasoconstrictors, decreased activities of vasodilators, and vascular wall remodeling as a result of endothelial and smooth muscle proliferation and chronic inflammation. In addition, increased vascular pressure injures the endothelium, activating coagulation, producing blood clots that further obstruct blood flow. For the second group, we have pulmonary hypertension caused by left heart disease. A number of conditions can lead to dysfunction to the left side of the heart, affecting its ability to pump effectively or to fill properly.
When left heart function is compromised, blood backs up in the lungs where it came from, causing congestion and increased pulmonary pressure. As this happens, fluid leaks from the blood vessels to lung tissue, resulting in pulmonary edema. Accumulation of fluid in the alveoli impedes the gas exchange process, causing respiratory symptoms.
For our next group, or the third group, we have pulmonary hypertension caused by lung disorders or low blood oxygen. When oxygen level is low, pulmonary vessels constrict in an attempt to shunt blood to better ventilated regions of the lungs. Conditions or circumstances that result in low blood oxygen are risk factors for developing pulmonary hypertension. Lung disorders such as chronic obstructive pulmonary disease also cause lung tissue damage, inflammation, and loss of capillaries, which further contribute to disease development. For our fourth group, we have pulmonary hypertension due to pulmonary artery obstruction.
Certain chronic disorders can repeatedly produce blood clots, typically in deep leg veins. The clots may travel to the lungs, blocking pulmonary arteries. If these clots do not resolve completely, pulmonary vessels can become narrower and stiffer.
Pulmonary arteries may be obstructed by tumors, parasites, or foreign particles. So for the fifth group, or our last group, it includes pulmonary hypertension by all other mechanisms.
Treatment should be aimed at the underlying cause whenever possible. Anticoagulants may be given to reduce the risk of blood clots. Vasodilators and supplemental oxygen can help relieve symptoms. However, vasodilators are only effective for certain types of pulmonary hypertension and should be tested for effectiveness before they can be prescribed.
That's all for my video. I hope you guys learned something from me, even just a little bit. Take care, you guys, and God bless us all. Bye!